Friends and subscribers, welcome to my next video. Today we are going to be talking about medical astrology, uh, a kind of an introduction to medical astrology. I call it an advanced introduction. Now, when we speak about medical astrology, we all know what it is, right? I mean, it is astrology has applied to health and disease, and loosely. I mean, we also uh, when we think of why we are not well, we have a loose kind of a thought process that surely I'm not well because I'm suffering from some diseases. I need to go to the doctor. And maybe if I do believe in astrology, maybe my time is not good. Certain planetary configurations are not very auspicious, possibly. But it honestly doesn't help us in a way that we can actually use medical astrology as a way of improving our health or as a way of preventing or maybe possibly treating disease. So I'm going to be talking about a few of these ideas today, and also about therefore also about the scope of medical astrology in our daily life. Some of you are subscribers of my channel, and I have put case studies on this channel about of various people of certain diseases like even autism, for example, diabetes mellitus, liver disease, tongue cancer, for example. Uh, and those of you who understand astrology probably listen to this with a lot of interest. But how do we actually make it applicable? What are the obstacles which stand in our way to make this happen? And what are the possibilities and the bright side of this study that the future may unfold? So today we are going to be speaking about all this. So welcome on board, right? So before we go ahead, this is my important disclaimer. Uh, as I said, the whole focus of this video is actually to make medical astrology sort of intelligible in the modern context wherein we are using modern medicine for the treatment and management of disease. I am a medical doctor, remember. I am an allopathic medical doctor, and therefore I completely and truly believe in what I have studied in terms of allopathy. However, I do realize that there may be certain limitations in the manner in which we interpret health and disease through the modern lens of allopathy. And I do believe that allopathy and Jyotish can be blended in a manner that we can truly benefit out of this in the future. So that's the whole focus of this talk, and that's the reason why I thought today we need to speak about what is medical astrology itself and a sort of a detailed introduction about this concept. Now, before we actually get into the larger picture, as I call it, I just want to bring to your attention some thinkers or some some sort of thought process which are ancient or which are old but which are very relevant to our discussion today. Hippocrates, we have the Hippocratic oath. Hippocrates was a Greek philosopher and also a healer, a physician. So he has said that uh, it's mandatory for every physician to have a knowledge of astrology. Okay, how can you heal a patient without the knowledge of astrology? So it shows that in his time the thought process of a doctor, a healer and an astrologer were actually synonymous. Today we find these thought processes are all disconnected from each other. You have a doctor and you have an astrologer who are separate, and in fact they rarely talk to each other. Okay, so that's one point I want to make. The second point is, or the second, let's say, something I want to speak about is, in Sanskrit we have these subhashitas. Subhashitas are sayings in Sanskrit, and some of these are very, very insightful. So one of them is as follows. It says, "Sharire jarjari bhute vyadhigraste kalevare. Sharire jarjari bhute vyadhigraste kalevare. औषधम जाह्नवी तोयम वैद्यो Narayano Harihi. What does it mean? It means that when the body becomes jarjara, as in starts disintegrating, and vyadhigraste, full of vyadhis, diseases, then the medicine is the water of the Ganges, Janhavi Toyam, Aushadam Janhavi Toyam. Okay, Vaidyo Narayano Harihi. So, and the physician is Narayana, is God Himself. Or another way of saying is that the physician is akin to God. So therefore again here, if the physician has to be having special abilities to understand the health and disease, it presupposes a knowledge of the celestial phenomena which impact health and disease, namely astrology. Okay, so this is sort of a take back to an earlier time, and then I'm coming back now to the larger picture. Now, basically, when you study health and disease in the context, when you look at medical astrology, we are not looking at curative. We are not looking at fixing something which is broken. We are trying to look at a picture wherein that the normal state of longevity, for example, of a human being is 100 years or even 120 years, the highest lifespan of a human being. But then it is not fully expressed. It doesn't get fully manifested because of health problems with health or disease. So therefore we die earlier than 120. We die at 90, we die at 80, we die at 70, whatever that may be. So there is a holistic well-being we are talking about. That's also the WHO definition of health. So anything that disturbs that is disease. So when we are talking about a derangement, we need to know what is normal as well. Okay. We are also talking about, when we say health, we mean that everything functions optimally. Okay. And therefore we are talking about doctor as a healer, somebody who rectifies. Now we need to actually understand that medical astrology or Jyotish and health are very deeply connected. So Ayurveda and Jyotish are actually siblings. They are actually both of them are Vedangas. Vedangas are called limbs of the Veda, and they are connected by the Panchamahabhuta concept. Okay, so you have the 5 elements which you are aware of, as in fire, earth, air, water, and the ether. Now you have all these except the ether, but you have the 4 elements reflected in each of the rashis of the zodiac signs. You have these elements which actually signify certain grahas. A graha could have a certain kind of a combination of elements. For example, the graha or the planet Mars would be fiery. Okay, the graha or the planet Moon would be watery. Okay, so we have these correlations, and there is a certain resonance with the WHO definition of health, which I already spoke to you about. So therefore allopathy, and therefore it's necessary to build a bridge between Ayurveda and allopathy, because today if I say somebody has, because of Vata Prakriti, he is having nerve problems as per the Ayurvedic concept, how do you understand it in allopathy? Okay, if we say that somebody has excess of the fire element or a pitta, and thereby he is maybe possibly having skin rashes, which is how we understand it in Ayurveda. How do you understand it in the allopathic concept, and how do you build the bridges? In allopathy, it will be a whole different way of looking at that disease, wherein we don't have fire element or pitta or kapha or these kind of concepts at all. Okay, So basically, initially medical astrology as it was taught originally, or as it was, let's say, understood in the ancient times. I am talking about when there was no allopathy at that time, when it was understood, when Jyotish and Ayurveda were understood together. There is a Vaman Purana in which the Adya Purush, the first man, as it were, Lord Shiva, speaks about this. Okay, but again, remember, I am talking of the older interpretative paradigm. What is really required is to bring medical astrology on par with modern medicine. Okay, I'm coming back to the same concept here in a different way. Now, look here. If I were to understand from the Jyotishiya perspective or from the astrological perspective the medical condition, one could say that okay, in Jupiter means kapha prakriti, or Sun is a pitta prakriti. So kapha would mean respiratory or chest diseases, very generally speaking. Pitta would mean hyperacidity, inflammation, fevers, gallbladder disease, for example. Vata would mean neurological disorders or joint pains, for example. Now, if you notice, this doesn't really help us much, because there could be a million types of Vata and hundreds and thousands of neurological disorders which are defined in allopathy. Uh, we have very specific conditions of inflammation. We have various kinds of fevers caused by different organisms which may have nothing to do with pitta. So you see, the whole domain is very complicated. So trying to understand allopathy through Ayurvedic eyes, as in the eyes of Ayurveda and Jyotish, is a complicated phenomenon, and that is what medical astrology attempts to do. Now, what are the challenges facing medical astrology? So obviously, one of the things, as I have already said, how do you correlate between Jyotish, Ayurveda and allopathy? Can we create a common syntax, a common conceptual and linguistic platform? Which means that if this is a combination of grahas which embody these characteristics, say of Ayurveda, it would mean this sort of a allopathic disease. Or can an allopathic disease be stated in terms of Ayurvedic and Jyotishiya concepts? Can a cirrhosis of liver be stated in terms of this way, the other way of looking at it? How do you bridge the know-how between Vedic Jyotish and Western astrology? Now, a lot of work in Western astrology has focused on medical astrology. In fact, I would say that the Vedic medical astrology or Vaidikya Jyotish is fairly stationary in its knowledge base. So what was written thousands of years ago by the rishis and interpreted in maybe in the last 1,000 years by stalwarts like Varaha Mihira, it has been static knowledge. It has stood there. Whereas a lot of work was done by Western astrologers in the last 200-300 years in terms of understanding significators of disease, specific significators. Okay, so what would a Saturn and a Mercury conjunction or mutual aspect say stand for? What kinds of diseases? So some people like Dr. Cornell, for example, have done a lot of work in compiling encyclopedias, their own clinical notes. These are doctors who actually also were astrologers, so they tried to combine their notes and find out and try to create some empirical evidence about significators of disease. Also, for example, outer planets like Neptune are very important. Neptune, Uranus and Pluto. Particularly, I would say Neptune, in my own experience, is very important in terms of medical astrology. And therefore, Neptune in different signs, what would it indicate? All these things are not available in traditional Vaidikya Jyotish. So how do you create a bridge between Vedic Jyotish and Western astrology? I think this is a very important challenge which medical astrology has to overcome. How do you make medical astrology curative? How do you make it curative? Can it be made curative firstly? And can it be made some sort of a sort of an inseparable part of modern medical protocols. So can it become like a must have healthcare support system which supports the doctor during his clinical diagnosis or even for clinical prognosis? This seems like an insurmountable challenge at this time as we speak, but I would I would say that this is really possible in the next 10 to 15 years if like-minded people really come together and crack this. Where can medical astrology help us? Now let us talk a little bit about how medical astrology can help us. One is the disease timing, onset and severity and progress. So when did the disease start? How long did it last? How severe, how rapid, how gradual it was? Did it slowly increase or was it very quick exacerbation? What happened first? What were the symptoms? What were the complaints? So all this is what we understand by disease onset and severity. Particularly, I'm sort of this is for the benefit of those of you who are not doctors. Okay, so who will be able to then appreciate what I'm talking about. Now, what could medical astrology really do? It could actually indicate when the disease could end or reduce in intensity. Clearly, because it's possible, in fact, very possible even right now, to sort of predict that when this disease would, at least when the symptoms would get grossly, let's say, ameliorated, or even when the disease could get aggravated. We already can talk about this. We can already figure this out from existing graha of the native and the dashas which is he or she is undergoing, as well as the current planetary transits of the gochar. We could also try to pinpoint a future onset of disease. So we could say that, look here, now this disease will be dormant for like maybe a year, but it could again flare back in next year and in this month. Okay, we could even do certain preventive measures in advance or remedies. So in Jyotish, in traditional Vaidikya Jyotish or Indian medical astrology, we call these upayas. So we can do some upayas or remedies. I'm sure the upayas could be sort of tailor-made for Western sensibilities. I'm sure there could be remedies which sort of resonate with that specific community or that culture, which we need to do some more research about. But these things can actually reduce intensity of a disease, and therefore, as Louis Pasteur once said, forewarned is forearmed. So I think if you know in advance that this disease is likely to be there for so much time, it's likely to go up and down in this fashion, then it can greatly help your allopathic treatment process as well, because the treating doctor can take advantage of these cycles, as it were. Now, the other area where, of course, is disease diagnosis. Now, what does disease diagnosis mean? That what is the disease? What is the mechanism of the disease? How the disease was produced? Where was the disease produced? Which part of the body, which organ system was involved? That's what disease diagnosis means. This is the most difficult area in medical astrology, clearly. So let me be very upfront about it. I have put this in capital letters in blue. The most difficult area in medical astrology. How do we diagnose? Now, when we have no clue. So imagine a newborn baby comes to you and his parents ask you, his or her parents ask you that, look here, this is my child and I want to know what kind of diseases this child will have as an adult. Is it possible? Is it even possible to forecast disease predilections or probabilities or propensities in the future. And how wise is it to do that? Can we be sure and confident that what we will predict is likely to come true? Is it really possible to do it? I would say it is possible. It is eminently possible to do it. However, it is the most difficult area in medical astrology, and it will necessitate. And what one realizes, what I realize as a student and as a researcher of medical astrology, is that our knowledge at this time is inadequate in this respect. It will necessitate detailed insights into nakshatras and graha karakas. Okay, today which we do not have. Uh, all knowledge which is available today is kind of is strewn across different books, different contexts, uh, and not really coherently available. Okay, and it needs updation also. So there are specific karakas of grahas and nakshatras which we don't even know what they stand for. We also need to understand uh, biochemical energetics vis-a-vis astrology. So I'm talking about maybe amino acids, and I'm talking about things like, I don't know, ATP and adenosine triphosphate energy molecules in the body and all that. And maybe these are governed by some specific nakshatras or some combinations wherein some transit moon, maybe some combinations, a transiting moon in a certain nakshatra at a certain time, things like that which we don't really know fully today. Um, a combination of different astrological approaches may be necessary. So medical astrology is one discipline which is essentially interdisciplinary. Okay, so it might sound a little corny, but it's an interdisciplinary discipline wherein we have to actually compulsorily use the concepts of Vedic Jyotish and blend them with Western astrology in terms of karakas, because Western astrology is very rich in terms of significators of disease. Okay, and try to blend these. We will need possibly special divisional charts for sure, and special graha dashas. We already know that we require a divisional chart called D3 or Dreshkan Kundali, but we may need specialized graha dashas also. Um, again, again, Indian astrology is very rich in this respect, I must say. So, but we need to actually know where to pick and choose. And as I said, finally, a integration of Jyotish, Ayurveda, and Western systems is what we will achieve. If we can do that, even partially, I would say, I think we would have made great strides in the ability of um, uh, medical astrology to effectively predict the future. Now, disease treatment is another area. How do you actually treat, or how do you do an intervention when there is a disease? Say somebody comes to you saying that, okay, I need to be operated for, let's say, gallbladder surgery, and it's an elective surgery, which means there is no urgency to operate like today, tomorrow. I can choose a date maybe after, within the next month. There could be a muhurta for surgery which could be defined. Uh, the elaborate knowledge base called electional astrology or muhurta jyotish, wherein specific time and date could be suggested to the doctor to operate for best results. Okay, so that's one. Um, One could support conventional medical treatment. So supposing, say, let's say somebody is being treated for diabetes and he's already taking medicines and you know pills and certain kinds of maybe special powders or whatever it is. Okay, uh, certain chants, certain kind of remedies can support this treatment so that it becomes more effective. And we have to have upayas, as I said earlier, and the essential focus of the upaya is to appease the graha or the planetary energy. Planetary energies which are astray, which which are troublesome create unease in us and disease eventually. Okay, so they need to be appeased. Now, what kind of questions arise? What kind of questions arise for medical astrology? When we look at this disease treatment panorama, whatever intervention we will do as a medical astrologer, can they be curative? Very doubtfully, possibly not is what I would say. Can they be palliative? Yes, for sure. I would say that they are not curative at this point of time. At this point of time in our understanding, possibly in the future we could work on something curative. Now, can a comparative research be done with a control group to check actual impact? So, which means that how do we know that these upayas actually work? Supposing you had not done any upaya and the patient would have become alright or would be out of danger in 2 months time or 1 month's time. And if you do an upaya along with the medical treatment, does it really help? How do we kind of compare? And can this be formalized as a healthcare support service in hospitals? Could we have hospitals which compulsorily, like if you are admitted in a hospital, let's say for a elective surgery, say, or say for a procedure like say angiography, and you're going to be in the hospital for two days. What happens? There is always a nutritionist who comes and asks you what do you eat. There is a dietitian. There is a physiotherapist. These are additional healthcare support services which are sort of ancillary to the main service that you have joined the hospital for. Can you imagine having a medical astrological service which comes and kind of guides you? This is what you should do to make your stay better in the hospital. Can these upayas be researched? Can they be upgraded? Can these be adapted to suit modern, let's say, requirements of religious sensibilities, for example, of all communities? Would that be possible? I mean, we might recommend Vishnu Sahasranam listening. Okay, but if the person who is the native who has disease is somehow very antagonistic to this idea because he possibly does not believe in this deity at all, or he is a non-Hindu, for example, how do you then still get him on board? What kind of a upaya can be sort of designed for him? And finally, could a curriculum for medical astrology become a reality in the future? Could it be taught? Could it be developed? Could it be taught in a manner that we are creating medical astrologers, at least a base level screening medical astrologer who can support actual patient treatment or patient management in hospitals? So these are the questions which arise, and I have already told you what's possible in medical astrology and currently what needs to be worked on. I am very excited about the opportunity to be able to work on this. I do believe very much that only practicing doctors or medical doctors should practice medical astrology, because it would necessitate an understanding of disease and organ systems and even allopathy as well as Jyotish. So to expect a non-doctor to be able to do that will be probably asking for too much. I would thank you for watching this, and please subscribe to my channel if you like it. This is a very dedicated medical astrology channel on the internet, and it's a very sincere effort by me. Thank you so much, and God bless.